¿Sí? Bueno, hola, buenas tardes a todos. Bienvenidos a esta sesión que se va a llamar Arte, Iconografía y Medicina. So welcome, good afternoon to this session called Art, Iconography and Medicine. We got the pleasure to have two of the speakers here with us. Another one is on video recording and the other one online. Let's go begin with them. He attended to the Congress. So begin with Amelian, please.
Good afternoon. Buenos dias. Thank you very much for the opportunity given me to be today here present and to present an interesting topic that Frank sign, which is more than a simple semiological element. 200 years ago, Voltaire declared the pathway to the heart is the ear. Perhaps inspired by this idea, the American physician Sander Frank in 1973 observed that existing a correlation between the crease of the earlobe and the cardiovascular disease. This element, bearing his name, is defined like a diagonal crease on the earlobe extending from the tragus across the lobule to the posterior edge of the auricle. Can be a purely unilateral, bilateral, the both men and women, and across all races. Of course, it can be expressed in various extending and depth. So we could classify it in 4 grades, like grade 1, just a small ridge on the earlobe, grade 2, a superficial crease on the earlobe reaching to its midpoint, grade 3, a crease extending over more than half of the earlobe, and grade 4, a deep crease across the entire surface of the earlobe. Multiple hypotheses was launched over the years, and the first one was microvascular lesion. It is exactly similar with the atherosclerosis of coronary disease. A decade later, the dermatologist pointed the lesion of collagen and elastic fibers can development this sign. Genetic studies incriminated the presence of HLA B27 gene and presence of shortened telomeres in peripheral leukocyte can development this sign. Embryological studies specifically state that the arteries from the earlobe are exactly like the arteries from the heart, terminal types arteries, which are sensitive to hypoxia. Increase the adipose tissue from the facial can causing chronic traction at the ear level and can development this sign presence. And the last studies about the protein clotho is implicated in development this sign. So the original study published in 1973, which examined 20 patients, we all had cardiovascular risk after coronarography, demonstrated the correlation between coronary pathology and the earlobe crease present in the patient. A contemporary case from my clinic when I'm working, 80 years old patient with unilateral, bilateral Frank sign present and cardiovascular risk associating revealed severe vessel disease, confirming predictive value of this subtle physical finding. Beyond clinical medicine, this semiological insight shed light on historical figures such as the Roman Emperor Hadrian. Reportedly suffered from hypertension with headaches and recurrent epistaxis, and later he developed heart failure. I don't know, maybe this heart failure is is development by this ischemic heart disease. Why I'm saying this? Because he had presence the Frank sign of the earlobe. In the first image is the sculpture from marble exposed in the British Museum, and the second image is the bronze marble exposed in the same British Museum. Another sculptures depicted him exposed in another museum like Paris, Madrid, Rome, Athens, and Vatican, revealed this Frankenstein present in the same earlobe. So we could conclude that he had a ischemic heart disease. Another example, the Gustave Flaubert, the celebrated writer, also displayed this crease in his post-mortem mask. Historical records confirm he died from a cerebrovascular event, underscoring the link between the earlobe crease and both coronary and cerebrovascular disease. Similarly, in art depicting in the same portrait, we have this sign depicted, like Jan van Eyck depicted Niccolo Albergati, who died a year later after he was depicted from cardiovascular disease. Jan van Eyck also depicted another 4 men from Europe, which this Frank sign presents. Inspired by this observation, we investigating papal history to examine the presence of Frank sign. The pontiffs were predisposed to heart disease, to the age, over metabolic disorder, chronic stress from leadership, sedentary lifestyle, and in some cases, genetic susceptibility. The first one is Pope Gregory XIV. He's known for his reforming the calendar, the Gregorian calendar we are utilizing in our days. He experiences high fever and edema in the lower limbs, and history of angina episodes suggesting pre-existing coronary artery disease. If we are looking attentively in this left ear, we see a notch is visible on the left earlobe resembling the Frank sign. Another portrait depicted him later some years is the same notch visible in the same left ear. So possible he suffered ischemic heart disease. Pope Leo XII, he is unpopular because he made some unpopular decision, strict prohibition against freedom of the press and freedom of expression, and he banned smallpox vaccination in the Papal States. He had some medical condition like renal lithiasis, and during the conclave when he was elected, he suffered from edema. After, he died from a severe sepsis by a chronic hemorrhoids, and necropsy showed us that he suffered of cardiomegaly. So the cardiomegaly reported at autopsy, and the apparent presence of Frank sign in his right earlobe can suggest that he suffered heart ischemic disease. Pope Leo XIII, he became the first pope to be filmed and photographed, and he had some familial antecedent because his father had died of cardiac condition, and he had some unhealthy pleasure, like he inhaled tobacco and consumed 2 fingers of Bordeaux wines daily. So his cardiac weakness, which made breathing difficult, and he experienced some acute heart failure. In this image, we can see the visible Frank sign as to clinical evidence, just a link between his health problem and underlying cardiovascular disorder. Pope Pius XI, he founded Vatican Radio, and he founded the modern Vaticans as we know in our days. He had some medical condition like diabetes and hypertension, and he suffered 2 heart attacks within a few hours. In this image, we can see the Frank sign is visible in the portrait which depicted him, and the image from his funeral. It can be observed underlying the heart ischemic condition from him. John Paul I, one of the shortest pontificate in history, only 43 days. He really enjoyed taking walks in the Vatican gardens, but in the last days of his life, he needed to stop frequently because the angina had reappeared, because he suffered from angina from his youth and associated shortness of breath and fatigue. Also, he had edema in his legs, and prior to his death, experienced another episode of angina pectoris. Recently, in 2018, the Vatican declassified some his files about his death and confirmed that he died from cardiac stroke, heart attack. So we can see in this image that he had frank sign visible bilateral in the left and right ear, supporting the hypothesis of underlying coronary disease and myocardial infection as the possible cause of death. Pope John XXIII, he is from a family with strong aggregation of cancer, and some years later, he suffered of cancer, gastric cancer, but he had the cardiovascular risk because he was obese and he consumed tobacco, and an oncological pathology associated with hemorrhage and severe anemia can develop heart failure through coronary pathology type 2 myocardial infarction. We can see in several photographs that he has the frank sign present on the left earlobe. Pope Benedict XVI, the first pontiff to resign after more than 600 years. He loved Mozart and he loved playing piano. He had some medical condition. He suffered strokes in 1991. He required a cardiac pacemaker for his irregular cardiac rhythm. Also, his older brother had required a pacemaker to correct an irregular heart rhythm. So he died in 2022 of cardiogenic shock, and we can see the frank sign is visible in various images of this Pope Benedict XVI, suggesting a link between his health problem and underlying cardiovascular disorder. Pope Francis, the first Jesuit Pope and the first from the Latin America, he was also the first Pope active on Instagram and Twitter. He had some medical condition. He suffered the surgery to remove a portion of his right lung, and he had some cardiovascular risk like diabetes and hypertension. Of course, this cardiovascular risk factor associated development later this year, cerebral stroke, after heart attack, and finally heart failure and death. So, supporting the hypothesis of underlying vascular pathology, frank sign can be observed clinical feature as being significantly associated with coronary and cerebrovascular disease to Pope Francis. In our days, some celebrities like Mel Gibson, Steven Spielberg, and George W. Bush have this sign present of the left earlobe and some cardiovascular disease. So the diagonal crease of the earlobe is a simple yet critical semiological feature, providing an essential complement to any cardiovascular assessment. A cardiovascular examination is completed when we examine the ears. Thank you. Muchas gracias.
So, thank you very much, Amelian. It's a very interesting study. Sit down if you want. Any question? ¿Alguien quiere hacerle alguna pregunta, Amelian? Okay. So, at the final, okay? So, let's continue. I would like to say, because I didn't present correctly to Amelian, he comes from Grigoretti Pope University of Medicine and Pharmacy, Lasi, in Romania. And now the second speaker is Andrei Ionut Cucu from University of Suceava, Romania.
Buenos dias. My name is Andrei Cucu, and together with my friends and collaborators, I will present a rare case of Parry-Romberg syndrome depicted in the 18th century votive offerings from an Orthodox monastery from Romania. The authors declare no conflicts of interest. Votive offerings represent a collection of objects made by from various materials and placed in a sacred location such as temple or church. The terms come from the Latin word votum, that means oath or promise. The purpose of these votive offerings was to express gratitude or to request a divine assistance. The origin of these anatomical votive offerings lies in the ancient Greece and Rome, and they represent parts of the body, like as you can see in the image, like eyes, ears, breast, feet, hands, or even genital organs for infertility. And they symbolize the diseased part of the body or the one being protected. As you can see in this slide, several Roman anatomical votive offerings from around 100 before Christ, a finger, a foot, a hand, a human torso, and a Roman head. Also, in this image, you can see anatomical votive offering from ancient Greek, created by Praxias and dedicated to the Asclepios, the god of healing, as an act of gratitude for the recovery from a probably facial disease or for restoration of sight. In the Eastern Christian Orthodox tradition, these anatomical votive offerings took the form of tamata, singular tama, plural tamata, that represent, as you can see in front of the icon, small metal votive plaques dedicated to God, to the Virgin Mary, or to a saint as a sign of gratitude or a request for divine assistance. We identify such tamata in Florești Monastery, an Orthodox monastery from the eastern Romania. The monastery was founded in the 1590, and the current structure dates back from the 1852 and features a neo-Gothic style that is very unusual for the Orthodox churches. Also, this monastery house a miracle-working icon of the Virgin Mary from 1749, donated by the Ecaterina Mavrocordat, the wife of the Constantin Mavrocordat, the Fanariot ruler at that time. She was healed of leprosy after she touched the wooden icon of Virgin Mary with her hands, and as an act of gratitude, she adorned the wooden icon with gold and silver. Also, this monastery houses a museum with a very rich collection, as you can see, tamata that depicts various ocular pathology. As you can see, palpebral ptosis and meiosis, cicatricial trachoma in late stage, ectropion of the lower eyelid, and mydriasis bilateralis. Also, we identify in the monastery collection tamata that depicts an angel, a child under the age of 10, portrayed as an angel with right hemifacial atrophy, also extended with the ipsilar upper with the ipsilateral hand atrophy, features consisting with the diagnosis of Parry-Romberg syndrome. Parry-Romberg syndrome is a rare disease with typical onset that occurs in childhood, and very interesting, it's a self-limiting disease. After a variable period of progression, the tissue destruction stabilizes around the age of 20. Characteristically involves one side of the face, and in rare cases, the atrophy may extend to the ipsilateral neck and to the ipsilateral upper arm. The main characteristic of this syndrome are enophthalmos and zygomatic and mandibular atrophy, as you can see in both images. Radiological investigation depicts usually soft tissue atrophy, skin and muscle, and also bone atrophy. Regarding the historical background of this syndrome, Parry-Romberg syndrome, the earliest descriptions date back from the Roman period of Egypt, and the characteristic was seen in a Fayum mummy. Also, the CT scan of the skull mummy identify a smaller right orbit and also asymmetry of the zygomatic arches. The first descriptions of this syndrome was made by Caleb Parry in 1825 in his medical writings, and he was followed by Moritz Heinrich Romberg, a German neurologist, that together with his nephew Eduard Heinrich Henoch completed the descriptions of this syndrome. In the same year, in 1846, Romberg published a medical article named Trophoneurose, in which he published a new theory for that time to explain the disease, the pathology of this syndrome, the theory of loss of nervous influence. He was followed by another German neurologist, Albert Eulenburg, that used a more descriptive term like hemiatrophia facialis progressiva. This means progressive hemifacial atrophy. In the 1892, in Edinburgh, Bramel published in his Atlas of Clinical Medicine the first documented photographs of Parry-Romberg syndrome, and 4 years later, in the book Anomalies and Curiosities of Medicine, this syndrome was included. In 1932, in America, Archambault and Fromm published the first monograph on progressive facial hemiatrophy with a rich collection of illustrative cases. And in 1945, also in the American continent, Wattenberg reviewed several hundred cases and discussed the connection between this facial atrophy and the scleroderma. In these images, you can see the characteristic lesion en coupe du sabre that is also met both in Parry-Romberg syndrome and in scleroderma. In 1943, Leuconia and Lorai published the first immunological observation on this syndrome, and in the 21st century, the multisystemic theory has been confirmed with autoimmune, neurogenic, inflammatory, and vascular involvement. Regarding returning to our Tama from Florești Monastery, we concluded that this Tama depicts a child under the age of 10, portrayed as an angel by the author, with characteristic of Parry-Romberg syndrome. You can see the enophthalmos, red arrow, and also zygomatic and mandibular atrophy. And the author also illustrated the atrophy of the upper limb of the hand. You can see the hand that holds the cross, and also the right wing was realized by author with the atrophy. In the literature are reported several cases with Parry-Romberg syndrome with extended ipsilateral upper limb atrophy. Very important, this atrophy of the upper limb, it's considered a systemic extension of the atrophic process from face and neck, not merely a local malformation. The atrophy of upper limb involvement may include mild bone shortening and muscular atrophy. The main differential diagnoses of Parry syndrome are made with Morphea and Coupe du Sabre, Barraquer-Simon syndrome, congenital hemifacial atrophy, isolated hemifacial atrophy, and post-traumatic or infectious fat necrosis. In Morphea and Coupe du Sabre, the lesion is located only to the skin. In Barraquer-Simon syndrome, the atrophy is symmetric and bilateral, as you can see in this image. And in the last ones, congenital, isolated, and post-traumatic infectious fat necrosis, there is no upper limb involvement. According to the level of evidence for iconodiagnosis, we concluded that in this case of the diagnosis was probably meeting the level 2. In a list of differential diagnoses, more observations are in favor of the established diagnosis. In conclusion, the votive offering depicts hemifacial atrophy represents not only an early artistic record of Parry-Romberg syndrome, but also a testimony to the historical awareness of disfigurement and healing. This case bridges medical diagnosis and cultural expression, revealing the deep human dimension of disease. Thank you very much.
So thank you very much, Andrei. It's very sorry. It's a great presentation. It's very interesting. Yes, both of them, both. Thank you very much. So now we are going to connect online with Joseline Vega Osornio. We are waiting for her, or maybe she was waiting for us from a few minutes. Ahora vamos a conectar con Joseline Vega Osornio de México, de la Universidad Autónoma de México, y estamos a la espera de que ella pueda hacernos la presentación. We are waiting for her from Autonomous University of Mexico. Hi, Joseline. Do you hear us?
Sí, buenas tardes, ¿me escuchan?
Hola, buenas tardes, Joseline. ¿Nos oyes?
Sí, ¿ustedes me escuchan?
Sí, te oímos perfectamente, Joseline. Adelante, cuando quieras.
Ok, muchas gracias. Buenas tardes a todos. Mi nombre es Joseline Vega Osornio y les voy a presentar parte de mi anteproyecto postdoctoral que se titula Psiquiatría y Psicopatología en la obra literaria de Fernando Pessoah. En este caso solamente me voy a enfocar al hecho de que el poeta portugués Fernando Pessoah asumió esta doble condición de genio y loco, temas con los cuales se familiarizó desde joven y que estudió de forma autodidacta en libros especializados. Mis preguntas de investigación tienen que ver con qué teorías contemporáneas sobre el genio y la locura estudió Pessoah como autodidacta, cómo fue que le ayudaron a afrontar su doble condición de genio y loco, y cómo le sirvieron justamente estas fuentes creativas para su obra literaria. Fernando Pessoah es reconocido actualmente por la crítica literaria como uno de los genios de la poesía. También es cierto que él desde pequeño pues tenía un miedo por padecer una locura de tipo genealógica, familiar, como en este cuadro donde él muestra un árbol genealógico donde aparece la demencia de su abuela, la tuberculosis de su padre, de su hermano y de el tío, Joseline, hermano de su papá.
Joseline, perdona, ¿sí? Discúlpame, soy Cristina, soy la moderadora. ¿Puedes esperar un momento que tenemos un problema técnico y nos estamos perdiendo tu presentación? Un segundito, danos un segundo. I'm telling to Joseline to wait for a minute to fix this problem, the technological problem, and enjoy her presentation. So I think we got it. Ya está, gracias. Ok, vale, Joseline, ya podemos seguir. Gracias.
Gracias. Y bueno, tenemos una cita de el joven poeta a los 18 años que dice que cada día se veía mayor un abismo espantoso que se estaba ensanchando frente a él. Yo era un genio, me di cuenta de la verdad y también vi esta otra verdad, que siendo un genio estaba loco. Les voy a presentar algunas citas del texto que se ha publicado hace 20 años como Los escritos sobre genio y locura, por el editor Jerónimo Pizarro, es decir, 100 años después prácticamente que Pessoah inició este trabajo. Y dice lo siguiente: el genio es la peor maldición con la que Dios puede bendecir a un hombre. Siguiente, el hombre de genio es antiatávico, está adelantado en su etapa evolutiva. Siguiente, el genio es la locura sana por la dilución en lo abstracto como un veneno convertido en medicina. Una cita sobre la locura. La vida consiste en el equilibrio de dos fuerzas, la de integración y desintegración, el anabolismo y catabolismo de los fisiólogos. Sobre los genios y los locos, variantes relacionadas porque el genio, sea lo que sea socialmente, es biológicamente una locura. Y bueno, así tenemos muchas citas sobre el tema del genio, que fue un tema que interesó mucho a Pessoah. El genio es conciencia social, es una fiebre mental perpetua, es el equilibrio del desequilibrado, es locura, una especie de delirio. El genio es incompetente para las actividades sociales que no involucran creación, y el genio es la coexistencia en una mente dotada con alguna habilidad especial y con una o más psiconeurosis. Algunos de los escritores que Pessoah consideraba como genios son los siguientes: Dante Alighieri, William Shakespeare, John Milton, Goethe, Víctor Hugo, genios de segundo orden, Lord Byron, Gerardo de Nerval, entre muchos otros. También voy a trabajar lo que tiene que ver con las lecturas que Fernando Pessoah hizo y de las cuales conservó algunos ejemplares en su biblioteca particular. Es importante resaltar que el tema del genio es un tema originalmente de interés para los románticos, y Pessoah se considera un heredero del romanticismo y un posromántico. Herder, que es uno de los pioneros del romanticismo, dice lo siguiente: el genio y la locura fueron temas como los cuales se deben de estudiar para examinar las nuevas bases del conocimiento del ser humano. Algunos de los autores que se encuentran en la biblioteca de Pessoah de interés para la psiquiatría y la psicopatología son los siguientes: Morel, Esquirol, Émile Dubois-Reymond, el doctor Charcot, el alumno del doctor Charcot y amigo de Henry Bergson, Pierre Janet, y Freud. Aunque de Freud no hay muchas notas o muchos testimonios de su lectura, lo consideraba también un genio por el sistema de psicoanálisis que desarrolló. Mención aparte requieren los trabajos de la psicopatología de Lombroso y de Max Nordau, de los cuales Pessoah dejó muchas notas escritas entre 1906 y 1907. Este tipo de lecturas le sirvieron también para crear muchas obras poéticas, creativas. Por ejemplo, esta obra del Barón de Teibe, que en este texto que se llama La educación del estoico, da las razones por cuales él merece o deben aceptar su suicidio. El tema de la degeneración fue un tema que interesó mucho a Pessoah, principalmente este texto que fue publicado en 1892 y que lo impactó enormemente. Otros de los autores fueron Joseph de Grasset, Paul Richer, Nordau, y muy importante también el psiquiatra portugués Egas Moniz, quien permitió, digamos, a Fernando Pessoah introducirse también al mundo poético de Portugal cuando él regresó a su ciudad natal, y que también le invitó a conocer pues temas de interés como el hipnotismo o como la gimnasia respiratoria. Hay muchos más autores como Alfred Binet, Charles Ferret, Todos ellos de alguna manera tuvieron un impacto en su obra creativa. Está, por ejemplo, aquí el texto de La Folie de Jésus, de Charles Binet-Sanglé, que inspira una obra ensayística de uno de sus primeros heterónimos o poetas ficticios llamado Alexander Serge. Entonces, bueno, les daré algunos ejemplos de cómo Pessoa utilizó estas fuentes de la psicopatología y la psiquiatría para inspiración en su obra. Bueno, el expolio de Pessoa, el archivo de Pessoa, cuenta prácticamente con 30,000 páginas. Parte de mi trabajo consistirá en justamente revisar el catálogo de ese archivo y tratar de entender cuáles son algunas de estas obras que pues quedaron influidas por estos estudios. También voy a revisar, bueno, algunos de los heterónimos que él creó. Ahora tenemos ya un listado como este, Yo soy una antología, por 136 autores ficticios, donde existen muchos de estos personajes que están relacionados con la psiquiatría o la psicopatología, ya sea porque son doctores, porque son psiquiatras, porque son pacientes. Hay, por ejemplo, el caso de este personaje, Faustino Antúnez, que es un psiquiatra ficticio, que él mismo diagnostica a Pessoa asumiendo que es su paciente. Y bueno, así seguiré de forma cronológica los autores que Fernando Pessoa inventó, como Charles Robert Anon, William Alexander Serge, autores que trabajan una obra colectiva, Alexander Serge, Jean-Sol de Meluret, el señor Pantelao. Jean-Sol de Meluret trata el tema del exhibicionismo, Alexander Serge tratará el desorden mental de Jesús, delirio y agonía, y el señor Pantelao hará una crítica política llamada psicosis adentativa y visiones del señor Pantelao, que de alguna manera ya están mostrando la destrucción de la guerra que vendrá en 1914, la Primera Guerra. También revisaré, bueno, en la obra poética cuáles son las influencias. Recordemos que Fernando Pessoa introduce el modernismo a Portugal y también crea, pues, revistas como esta, que es Atena, también dirigida por un personaje ficticio, una especie de antiguo sabio que se llama Antonio Mora. Sucede que es un paciente fantasmagórico de la Casa de Salud de Cascais, donde se encuentran muchos heterónimos, como Alberto Caeiro, Álvaro de Campos y Ricardo Reis, tratando de dilucidar la forma de salvaguardar a Portugal y Europa de la destrucción de la Gran Guerra. Otro ejemplo, quizá ya para terminar, es el de Heróstrato, este personaje histórico responsable de la destrucción del templo de Artemisa, quien trata de buscar a través del crimen esa inmortalidad. Y finalmente, pues trabajaré lo que tenga que ver con el mesianismo en la última obra poética de Fernando Pessoa, que es Mensaje, y donde de alguna manera él logra sintetizar pues todo el conocimiento adquirido durante 3 décadas de estudio, tanto de fuentes clínicas, médicas, exotéricas, como también de fuentes esotéricas, no solamente de la historia de Portugal, sino de toda la tradición de la cultura occidental, como los neoplatónicos, los gnósticos, etcétera. Y bueno, mi conclusión, si tengo todavía tiempo, es, como decía Pessoa, en cualquier caso, la creación de mis heterónimos tiene que ver con una tendencia constante y orgánica a la depersonalización y a la disimulación. Y finalmente, pues mencionar este texto o este trabajo de Deleuze que me ha dado mucha guía y mucha luz al relacionar a Fernando Pessoa con toda una corriente de poetas, sobre todo poetas simbolistas, que de alguna manera convierten en forma alquímica este genio, ¿no? en una época complicada, una época de transición que es la que ellos viven, y cómo a través de su creación poética encuentran la gran salud que la literatura les ha podido ofrecer. Eso es todo, muchas gracias.
Muchas gracias, Joseline. Todavía me oyes, ¿verdad?
Sí,
Vale,
gracias.
no te retires, por favor, por si acaso al final de la sesión alguien quisiera realizarte alguna pregunta. ¿Es posible?
Sí, claro que sí. Gracias.
Fenomenal. Muchas gracias. She's going to be there if you want to make any question at the final of the session, okay? So the last one is a video recording, videotape from Antonio Perciaccante, from Italy, Azienda Sanitaria Universitaria Giuliano Isontina, Ospedale di Gorizia. He sends the videotape. One moment.
Dear Chairman, dear colleagues, buenas tardes. My name is Antonio Perciaccante, I'm an Italian doctor, and I'm so sorry to cannot be in Madrid. Dear Chairman, dear colleagues, buenas tardes. My name is Antonio Perciaccante, I'm an Italian doctor, and I'm so sorry to cannot be in Madrid. My presentation is about iconodiagnosis as some recommendation to make a correct iconodiagnosis. What is iconodiagnosis? Iconodiagnosis is the medical analysis of artworks. In particular, is the application of medical diagnostic knowledge to abnormalities and pathological conditions which are present in artworks. This is an example. When we look at this painting, we immediately notice a rhinophyma. Iconodiagnosis can be helpful in different fields, such as history of medicine and medical training. In history of medicine, iconodiagnosis it is important because it may provide information on pathological condition represented in different historical periods. In medical training, it may help a medical student and physician to develop and improve the same observational, descriptive, and interpretative skills used in clinical practice, as supported by many papers in literature. Diagnostic process in medicine is a three-stage model: making a diagnostic hypothesis, refining the diagnostic hypothesis, defining the final diagnosis. Diagnostic process in iconodiagnostic is the same. This is how people think diagnostic process is, but this is how it really is. It is a process complex and may present many pitfalls that can cause misdiagnosis. So it is important to have guidelines and recommendations to make a correct iconodiagnosis. First recommendation: observe the artwork in persona or on high-resolution images and investigate about eventual restoration. This is a case of Sic Bacchus by Michelangelo Merisi da Caravaggio. Some colleagues looking at this image hypothesize that Bacchus suffered from jaundice. But this was a misdiagnosis because the real image is this. Second recommendation: it is important the reconstruction of the history of the artwork. When I received this painting and when I looked at this painting at first time, I hypothesized a psychiatric disease or demoniac possession. But after I received this document from the museum and discovered that the girl was bitten from a dog. So I changed my hypothesis and I hypothesized that it is the first case of artistic representation of a case of encephalic or furious rabies. Moreover, it is important to study the life of the artist and his pathography, and to know the medical knowledge at the time in which the work was created. This is the self-portrait by Dick Cat. We can notice finger clubbing and cyanosis at his nose, and they are element in agreement with his pathography. Indeed, we know that the cat suffered from a congenital heart disease. Moreover, it is important to control a portrait by comparing representation of the same subject by different artists to confirm our hypothesis. This is Giovanni Francesco Barbieri, also called Il Guercino. This is his self-portrait. Looking at this image, we can hypothesize a convergent strabismus of right eye. That is confirmed analyzing the painting, the portrait of the same subject by different painters. Indeed, we can see the presence of strabismus. It is important to know the written document about the subject, such as letters, biographies, medical reports. Always the case of Giovanni Francesco Barbieri. His biography confirmed the presence of strabismus since his childhood. Moreover, it is important to contextualize the historical artistic period in which the artwork was created and evaluate the artwork of the same authors or the other contemporary authors. This is another portrait. It is the portrait of Bartolomeo Panciatichi by Agnolo di Cosimo di Mariano, also called Il Bronzino. Some authors focus their attention on Panciatichi's left hand, and due to position of the last two fingers, they hypothesize it is a claw hand, and so they hypothesize a case of unilateral ulnar pathology. But they don't text their hypothesis. So, when we go to search for further paintings depicting Bartolomeo Panciatichi or read his biography, we discover that no further portraits of Bartolomeo Panciatichi are present and no interesting information from his biography. So, we go to evaluate the further portraits by Agnolo Bronzino, further portrait by the same author. And we discover that all people have the strange hands. So, is it an epidemic of neurological disorders? No, it is mannerism. Mannerism is the artistic style that follow the Renaissance. Agnolo Bronzino was one of the most eminent painters. Manner broke all previous code of anatomical proportion, and the human figures were depicted in asymmetrical position with elongated proportions or in natural body position, as you can see in these paintings. It is also important to know the theological and pagan symbolisms. In this painting by William Hogarth, if we look at the subject at our left side, we can see a black grit lesion at his neck. We can hypothesize it is a melanoma, but really it is the symbol Hogarth used to indicate the syphilis. Finally, it is important to consult medical practitioner with expertise in the area of the presumed disease and discuss our diagnostic hypothesis with the iconodiagnostic team. Indeed, this is the famous creation of Adamo by Michelangelo Buonarroti in Sistine Chapel in Vatican museums. Some authors saw in this image the sagittal section of the encephalus. In the same image, other authors saw a postpartum uterus. So, in conclusion, when we approach iconodiagnosis, we have to keep in mind the words of German philosopher Walter Benjamin. To arrive at the purity of the gates is not difficult, it's impossible. But why it is impossible? Because in a silent way, our interior lens, made up of professional and personal experiences and history, can change our look on the world and the way in which we analyze reality. So it is important to have guidelines and a recommendation to follow to make a correct iconodiagnosis. This is my personal email for question or information, and also the website of International Society of Iconodiagnosis. Sincere thanks for your kind attention, and I hope to meet you in further time. Thank you. Bye.
Thank you to Antonio too, because it was an amazing presentation. So I want to congratulate all our speakers.